And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CISL 650.
And welcome to the show. I'm Zach Spencer. This is Boomer Life on CISL 650. And today we're talking with Element Lifestyle Retirement. We have Candy Ho. Welcome back to the show. Good to have you. Happy New Year. I guess we can go a couple weeks and say Happy New Year, right?
Yes.
Candy is the Director, Vice President of Marketing and Corporate Relations of Element Lifestyle Retirement. And we have our guest, Dr. John Gilbert here, Independent Director of Element Lifestyles as well. Welcome to the show, Dr. Gilbert.
Good morning.
Now, I want you, Candy, to introduce Dr. Gilbert and sort of tell us a little bit about him, because I know he's an Order of Canada recipient, and I want to get into that because the first time, Dr. Gilbert, we've ever had an Order of Canada recipient on the show. So that's a big deal. But Candy, why don't you introduce Dr. Gilbert, how you met and how it kind of fits in with what you're doing at Element.
Okay, so Order of Canada is only one of an endless list of accolades, and he's very humble and grounded about it, but he's basically a world leader in healthcare, education, training, and he is still very active, goes around the world. How many miles did you travel last year speaking and inspiring people
about 132,000.
Yeah,
132,000 miles traveling to speak around the world about this topic. And I met him at UBC when I was doing integrated health sciences, and went on to an organization called Health Sciences Students Association, HSSA. So I was president back then, and he started out being my leadership mentor, and then now he's I call him, I kind of give myself the honor to call him my almost godfather to me, and my son's god grandfather, because he'll sit him on his lap at Christmas by his warm fireplace at home. But he's like that to all his students, inspiring them, and what he does is to promote professional education and training in healthcare.
All right. And so when you were developing the Element Lifestyle Retirement that you're going to be developing at King Ed in Cambie, you decided, well, he has to be part of it.
Well, it's a perfect fit because we're doing this in Canada as also overseas, and the most critical part about providing retirement homes and care and support is the people. It's like if you've got the hardware but not the right people and the staff and the people with the right attitude and the right communication between them, collaboration, then everything falls apart, and there's no, So he is going to help us set up training academies and direct that. Yeah.
That's great. So Opal by Element is at King Ed in Cambie, and we're going to talk about the development you're putting together in a little bit. But we want to first talk to Dr. Gilbert. Welcome to the show. And so Order of Canada, I've always seen people where I see Peter Mansbridge wearing his every night when he does the news, and you've got yours on your lapel as well. But I always think that's a very that's rare air. People get to be named a recipient of the Order of Canada. What was that like?
Well, it's Canada's highest civilian order.
Yeah.
And recognition for work that you've done locally, federally, internationally. It's a huge honor. It doesn't go to everybody.
No.
And the award ceremony itself is spectacular because the Governor General is, of course, the person who gives you the award. And it's held in Governor General's mansion.
Rideau Hall, yeah.
Rideau Hall.
Yeah.
It's just a very, very special occasion. And as you know, I'm an immigrant. I came to Canada when I was 25 and a half. And I've always looked back at that decision as the best decision of my life.
And
well, I grew up I was born in the war in England. And England is still very class-ridden. Well, I don't care what anybody says.
Well, my family's all from there, and I talk to them about it.
Yeah.
But you have to go to the school, and it's crazy.
And have the right accent, and so on. And so I didn't come from that strata of society, but I did have a very good education. But then I went to the United States as a Fulbright scholar, and I discovered that people actually took a shower every day because the water was hot, which was great. There were these marvelous places called supermarkets where you could buy almost anything, whereas in England, of course, we'd come off rationing like barely 10 years before, and food was still scarce. There was no concern about the way you spoke. Nobody asked you, which school you went to, et cetera. So when I finished my Fulbright, the requirements of Senator Fulbright about that was that you would go back to your country for 2 years, because the idea was then you would build in your own country the kind of principles of liberalism and democracy that existed in the United States. I'm not so sure at the moment. But I didn't really want to go back to England. I discovered, as I said, hot water and wonderful food and the friendliness of people. And somebody told me there was a job at UBC, and I applied and I was accepted. And frankly, looking back, it's been amazing. It's been an amazing country for me. It gave me all the opportunities I would never, ever have had in the United Kingdom.
Oh, that's great. I think you represent the Order of Canada well then. It's a real honor to have. So what part of your work career do you think represented or really sort of propelled you to get that order? What is it that you've got such a long resume and history, but what do you think it is that you have bottled and provided for people that really has put you in the forefront of what you do? Well,
I had really two parts to my academic career. The first was we had a dean of medicine at UBC. My appointment was in medicine, although I'm not a physician.
Right.
I understand that. I'm a PhD. And so my first role was to build a program for audiologists and speech-language pathologists at UBC, because there had been a royal commission in the early 60s. We always have royal commissions, right, to figure out what we're going to do with the healthcare system. And that royal commission had said there should be a school at UBC, Toronto, and McGill, and Dalhousie. So my dean at that time, I was very young, said, well, you're going to do it. And so I worked, and we built a really, really good program, which now, is the only one in British Columbia, and we train audiologists, speech-language pathologists for all those people with speech and hearing problems, speech-language and hearing problems. But then at a particular stage in my career, when I had stepped down from that role after about 20 years, and I had also run the School of Rehab Sciences, which is OT and PT, I was asked if I would take on a different job in the university, which was more global in terms of looking at all of the health human service programs and trying to figure out, what we should do with them. And I became very interested then in health education policy and then health policy, and why it was that we have so much difficulty building teamwork within the healthcare system, because everybody's trained in silos, So we have medicine here and pharmacy and nursing, and they're all in their own buildings and they have their own curricula. And it was very clear that the effects of this on the healthcare system are quite profound, because...
And expensive, too.
Because they seldom know anything about each other's work. Right. So I got really interested in that. And so the second part of my career was about building this approach to education, interprofessional education, for collaborative, patient-centered practice. So we've become... it's very interesting. We've become very, very interested in collaborative teamwork. In fact, the United Nations Commission, which reported just before Christmas, remember Holland and Zuma were the co-chairs of that very, very important commission, and it actually has interprofessional education for collaborative practice twice, because I helped to write it.
Oh, good for you.
That particular part. And then around workforce, because we've been looking at the shortage of people in the healthcare fields around the world, it was clear that we had to approach workforce in a different way, that you just couldn't go on training more of the X's and the Y's and the Z's, because you just got the same results. So
you just have more X's, Y's, and Z's.
That's right, and you don't have this interprofessional collaborative
So you
practice.
have to take all those letters and make a word.
That's right,
that
you
all
try
works
to.
Together, right?
You try to. So that's... So that was the second part. So the Order of Canada was recognition of both of those things, both of those parts of my career, and they've, and that second part of my career isn't over. I still work every day. And,
Well, I can see how with your background and the way you've tried to bring different parts of healthcare together to work collaboratively works well with what you're trying to achieve at Element, which is that you're trying to get this sort of cohesive way of living. It's not just the healthcare; it's a lifestyle. So Opal at Element is explain to give us the 30,000 foot, because Dr. Gilbert flies a lot. The 30,000 foot look at what you're trying to do, building off what Dr. Gilbert just mentioned. So you're building everything together.
Yeah, and like Dr. Gilbert thinks about things in a very global and conceptual way, and tries to make a difference and go beyond status quo. And it might take a generation, 30 years, 40 years. It's the same thing that we're trying to achieve as well, and that is to revolutionize the perception and experience of retirement and aging that actually John perfectly embodies. That he's retired in his idea that he doesn't have to work, but he does work every day by choice because he feels an incredible sense of purpose that he's making a difference in this world, and he's so good at what he does, and it just flows from him. But he's very much active, and I don't even know how to say how important his contributions are.
I would say also that you talked about this collaborative idea within the medicine that people, so you have to have pharmacy and nursing and the doctors all working together. Well, that's what you're trying to do at Element. You're trying to bring elders, or we also call them seniors, and younger members of society together, along with maybe healthcare and assisted living. So you're pulling all that together.
We do hospitality and real estate as well as care, nursing care, and then we'll also have medical director that will prevent unnecessary hospital transfers. We will have OTs and PTs and dietary counselors and all sorts of therapists coming in. So very important that there is that collaborative piece. And when I was in UBC and on HSSA, that was what it was about, and it really inspired me that of course there needs to be communication to prevent lots of mistakes, but also to improve the quality of care, integrate each other's work.
Now, Dr. Gilbert, Candy's been on many times talking about how we want to have this intergenerational place to be and to exist and to continue your life, not just after retirement. What do you feel how important that is to have a different in our society? We kind of shutter older people away and let them live their life on their own, and what Candy's trying to do is to bring other elements into it to help keep them energized as they get a little older.
Well, there are two major ideas about how to handle that kind of mature elder years of your life. One is to ensure that should you need care, then that care is provided, and the government provides some of those facilities. And the other is to say, well, at least on the government side, provincial government side, that's a really expensive way to take care of elder people. And maybe if they have a home and we can provide service in the home, providing service in the home is less expensive and so on. But that's not the idea of Opal. Opal is about saying, I no longer want to be in that house because take me and my wife, we have two people in a very large house. We want to be in a place where if we do, in fact, begin to deteriorate, our health begins to deteriorate, we can stay there. We can stay there right to the end. And it doesn't matter whether it's one of us or both of us. Opal is saying, we're not going to boot you out. And there are many, many high-level, very expensive senior residences, retirement residences that say, sorry, you've got dementia, you got to go somewhere else. And that is very hard, both for the individual involved. Supposing that you're supposing that you're 85 or 90, and then somebody says, well, you can't live here anymore. And it's very hard on the family because then you have to make these big adjustments. So Opal's notion of this continuum where you can go in fit, healthy, because we don't talk about it as a medical facility. It's called. It's about good health. You can go in. The lifestyle is very nice. We're going to have a daycare. There's a garden, etc. And then as you progress and you get a little more fragile, then the care is still there. And then when one of you goes, you don't have to leave.
You have to leave.
And that's really unique. Really unique.
When we come back, we're going to speak with Dr. John Gilbert again. He's the Independent Director of Element Lifestyle. And Candy Ho here is with us as well, Vice President, Marketing and Corporate Relations. Opal by Element is at the corner of King Ed and Cambie. We'll talk a little bit about the facility that hasn't been built yet and where you're at with that. But I also want to touch on, Dr. Gilbert, when we come back about how important it is to keep couples together.
Yes.
Next on CISL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CISL 650. We're back. This is Boomer Life on CISL 650.
We are family. I've got all my sisters with me.
And welcome back to the show on CISL 650. I'm Zach Spencer, and today we're talking with Element Lifestyle Retirement. We have Opal by Element at the corner of King Edward and Cambie that hasn't broken ground yet. You're getting started on that. Candy Ho is here, Director and Vice President, Marketing and Corporate Relations. And our special guest today is Dr. John Gilbert, Independent Director, Element Lifestyle. So, the very first show we had here, you came in with your dad. And we talked about his background in the retirement industry, I guess, and his sort of vision for keeping people together.
Yes.
And this was all because of his parents as they got older. One was at a different stage of health than the other, right? And that's really what you're trying to do here, is to keep people together through all stages as they get a little bit older. And so, Dr. Gilbert, can you explain how important that is when you have, what age would you say? In their middle 50s, maybe somebody starting to get a little, the health starts to change, and you have somebody that's still able to walk and move and do all those things. Somebody might have some kind of chronic illness, and they have very different stages. And so and as you get older, that separation only gets worse, right?
Well, I would say that most people, young people in their late 30s, don't realize that they're actually getting older.
Right.
And so we have lots of discussions about planning for those years. Okay?
Right.
So, and it is true that in the 40s, people, male and female, begin to discover that their bodies probably have a finite, et cetera. And that if they are, in fact, together, whether it's a conjoint relationship or a marriage, it doesn't matter, that actually it's rather nice to have somebody there when you come home and you have a bit of an ache and they say, oh, well, let's have a cup of tea and we'll sit down and have a chat, et cetera. And what I think...
and there's a mental side
and there's
of it too.
The whole mental piece of this. And so those relationships, they can take interesting turns. I have a friend in England who just got divorced after 40 years of marriage. So, these things do happen. But... if you take the majority of people who are together, aging, and want to stay together, the notion that if one of them gets sick and they will be separated, particularly if it's now 50 years that they've been together, is very disturbing. It really is disturbing because you have the mental thing, you have this physical, like the touching that goes on, just as a natural. So the idea that, oh my God, we are not going to be together is really frightening.
Well, there was a story in the news recently, within the past 6 or 8 months, about the elderly couple that they were in the public system and they couldn't keep them together for whatever reason. And the picture of the husband and wife kissing as they were just about to be separated, and that went viral. That went around the world. And the reaction was so overwhelming that the government finally got them together. But that's exactly what you're trying to avoid here, right? Is that separation. So Candy, what you're trying to say to people is, and Dr. Gilbert mentioned this, you live in this house, it's gone through the roof in value since you bought it years ago. Downsize, sell the bigger home, move into a place where you're safe and secure for many years to come. So explain how that would work. Somebody comes to you and they come to Opal by Element, and then what size of units do you have? And
well, we have a big range because of choice. So our studios and rentals start at 453 and then go up to 2 bedrooms, even in rentals at 938 with their own in-suite laundry and in-suite storage. And then the condominiums start at 612 up to 2,324 feet.
Wow.
So it is about choice. Some people want to downsize and keep it simple, not have to tidy their place constantly.
Well, downsize meaning they don't have to cut the grass and take, all
the maintenance.
And shovel the snow.
It's living in a large home. There's a lot of maintenance that you have to handle yourself. And here we have people to help you with that. But when you talk about the government not being able to keep those two together is because of certain restrictions and policies. You can't do this, you cannot do that, and then you just have to force people apart. Well, in even our own even Element, for example, or CPAC that we used to do, we have to be very careful to select people in our organization who share our vision, that we're not afraid of challenges and difficulty, and we're not going to turn away people because it's just too difficult and complicated to operate, because that's not what we are about. We're not, unless it's actually unsafe for that person. Say you need an actual specialized care unit that provides dementia care, that you can keep those people there even if they're combative and physically.
But I think we're trying to back this up, that they would go in there, like I mentioned, downsize their home and move in before all of those things happen, because you might have somebody that's got some health issues, but it's not really interfering with their life to a great extent. But as you age in place, that's the main thing. You want to be in place, right?
So ours, we have independent living. You're totally healthy and active, very socially connected and physically fully capable, doing gym every day. And then you can either rent or you purchase that suite and you stay in it, and we just provide the staffing as you need, depending on what you need, whether it is just some medication reminders. We can also manage your refills and coordinate with your physician, or you may need shower assistance or grooming and those things, and that can be provided in your suite, whether you rent or you own, and you don't need to move. But if you then progress further and actually need registered nursing type care, which is different than care aides and licensed practical nurses, then you can have priority access into our care area, which is dedicated and secured with registered nurse, licensed practical nurse, care aide, medical director, and then whatever other profession that is needed to support that profile of residents, what their conditions might be. So you never have to move. And if you both move in totally healthy, then if one, developed dementia, they could stay in their suite for a certain amount of time. We have case managers assessing their condition, but then as it progresses, then we would be able to advise when they ought to be in the care area.
We hear a lot about dementia, but I think a lot of people, as they get older, it's just mobility. They lose flexibility. They, and it's not. You just basically can't get around as well. That's
I'm
my
just giving
dad.
An example there.
My dad is 84 years old, and he's got arthritis, and he has a real hard time moving around. So for him, it's getting into the shower, getting out of the shower, all of those. It's just basic stuff, right?
Like living in a single family home. A lot of people are just simply the challenge is getting up the stairs and down the stairs.
I keep begging him to sell his house and move into an apartment where it's all on one level, but he still struggles up the stairs every day. So what was your advice to Candy and her father when they wanted to start Element about what they were trying to integrate here? What did, from your expertise, bring to them and say, what did you layer on top for their ideas?
Let me just say, I never give people advice. I discovered a long time ago that I never take any notice if I give them advice anyway. So I just have observations about what has come out of kind of the research around elder living and what we know about the aging process. You just mentioned, yes, mobility is a major problem, but so is vision, hearing, and teeth. Those
really,
it's feet, eyes, ears, and mouth, which are the big. They're the big things you have to take care of. So let me just give you an example. If you have a problem with your teeth, then it turns into a problem with your digestion, which then turns into gut problems, which then turn into other kinds. If you have problems with your feet, then you can't walk, so your mobility falls off, etc. with your eyes, we no longer can read properly,
Right.
and then hearing. And so, so what we've learned is that when opal develops, we probably have to keep the lens on specifically on those areas, because they're the ones that will cause the most problems as you age. Mm-hmm. The mental piece is it's so difficult to judge. Whereas you can measure, the eyes, the ears, the feet, and the mouth. Right? You can do so, but the mental piece is really hard. So my role as an independent director is to say, well, and Candy gets stuff that I send her, to say, look, this is what the research is telling us at the moment. As you develop opal, mm-hmm. let's make sure that it's evidence-based practical care,
right?
That there is a basis for doing this. It's not something that just dreamed up mm-hmm. out of the air. We have data. We can show that this is what's effective, etc. Mm-hmm. So that's my role. Is kind of to be a eminence grise, if you like, rather than an advisor.
But also, when we're wanting to establish that training academy, that he would be able to help us, because he founded audiology and speech sciences. He directed rehab, and then he founded the College of Health Disciplines at UBC. So that is his expertise that we will definitely need to call on as we get mm-hmm. further and further along there.
Our guests today are Candy Ho, Vice President, Marketing and Corporate Relations at Element Lifestyle, and Dr. John Gilbert, Independent Director, Element Lifestyle. We're talking about Opal by Element, and I live in the neighborhood, mm-hmm. so this future project, because you haven't broken ground yet.
We've demolished some houses, though.
There's a bit of a demo stage, which is always fun.
The process is meant of weeks long, where it used to be one day, boom.
Yeah,
but now we have to
take
recycle
all the
parts
stuff
and so on.
out of it. Yeah, I've always wanted to be the guy with the backhoe that tips the house over. I thought that would be kind of fun. But at King Edward and Cambie, so I live in that Douglas Park neighborhood, and it's a wonderful location because for those that are still able to take transit, you can go right downtown on the Canada line. You've got Queen Elizabeth Park in your back door.
Community Center.
It's very central. There's some great restaurants near there. Yes. We talked about the hot pot across the street. So this corner is going to be transformed, mm-hmm. and it's pretty much a whole block that you're taking down mm-hmm. for Opal by Element. So this is, when are you starting? So you've started to take the houses that are there now. When do you see it being finished?
It should be the first half year of 2019.
Mm-hmm.
And
so it's a couple of years from now, yeah.
Yeah, it takes 24 months to build, and when we actually break ground just entirely depends on the city's issuance of a permit that they already said, is fine, and we've got everything in application, but they've got about this big of a stack of papers to process.
Yeah.
But
well, I have a friend who just
expected January or so, February, we should be doing our groundbreaking and then starting to...
I don't think you're alone on that. My friend bought a lot in the neighborhood and is waiting for his permits to get started, and it's taking longer than he thought. I think that's...
Well, a laneway house can take like 2 years. A tree delayed us by 8 months.
Really?
Mm-hmm.
Well, that's probably an important tree. All right, so... the development is, how many units are you going to have in there? What I find interesting is that you are going to have rentals and you're going to sell. Mm-hmm. And when you rent something, you are still invested. You're not just the developer. You are still invested because you're operating it. So explain that decision. Your dad did that years ago too, right? Mm-hmm. Having the rentals and the...
Well, we wanted to offer choice because there's a lot of people who like to continue to own an asset and pass on an estate. Mm-hmm. And retain that value. But then there's also people who just want to simplify because with rental, and you just got one rate that includes the utilities and the property taxes, and there's no strata fee, there's no anything. Everything is all included. It's just simpler for them. And then if they need to move on to care, it's a lot faster. Or a lot less things to handle than trying to think, should I rent out my space? Should I sell it? Should I pass it on?
Right.
So we do both of that, but also it's really important to us that we do say we have a vested interest in it, that we continue to manage and operate, because as I said earlier, the physical hardware is... designing it to be able to accommodate certain activities and amenities is important, but then the people that run it is the difference. Mm-hmm. The philosophy behind it, the values behind it, like saying, we're not going to kick you out because of this and that. We're going to bend over backwards to work with you, right? Yeah.
So we're talking about Opal by Element, as I mentioned, at the corner of King Edward and Cambie, and it's getting started, working with the city. And when we come back, I want to talk a little bit about, just how many people are coming into those, as Dr. Gilbert referenced, elder years, right? And it's accelerating because we have that big bubble of baby boomers, and the show is called Boomer Life, and we'll pick it up next on CISL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CISL 650. We're back. This is Boomer Life on CISL 650.
You made me so very happy. I'm so glad you came into my life.
And welcome back to the show on CISL 650. I'm Zach Spencer, and today we're talking about, change in lifestyle as you get a little bit older and maybe thinking about your plans for the future. With us from Element Lifestyle Retirement is Candy Ho, Vice President Marketing and Corporate Relations, and Dr. John Gilbert, Independent Director, Element Lifestyle. Now, we talked a little bit before the break, touched on a little bit about keeping families together, but let's just get into the numbers. We are now at this... They call it the baby boomers because it's a big bubble of people that are going to fully be retired in 15 years. So I'm right on the cusp of that. I'm a first-year Gen Xer. This is a big challenge for society, isn't it? All of these people are going to be getting older, and it's a big number. And do you think we're ready for that? That's a loaded question.
I'll let John speak about this. I mean, Dr. Gilbert. Yes.
I think there's a lot of thought being given to the issues, and there are some societies where there is more thought being given than others because the problem is bigger. So in high-income developed countries, this is a huge issue. But if you go to Africa or an Asian country where actually the big block is around 20 to 28.
Really?
It's not at this end of the continuum.
But we can look at Japan that has an older...
But when you could look at Japan and, certainly China, which has, all those single, family, the single child.
Policy.
Yeah, and it's a huge, huge issue. I think that it's an almost overwhelming problem for government because there are many, many other issues that are going to be part of this complex of what are we going to do in order to ensure that the receding taxpayer base, is not lumbered with this huge expense. So that's why when I spoke earlier, I said that, the government's faced with, do we build, and let's just not talk about Opal, but just government facilities. Do we build more facilities, more government facilities for the aging? Or do we try to keep people where they are, age at home, provide the care that we can do at home? So there's still...
And sorry to interject, but what do the people want to see? I'm sure most people want to stay in place, right?
I suspect that if you look at the data, that is in fact correct to a certain age.
Right.
But then, probably 75% will say, I can't manage this anymore.
And the loneliness of being at home and waiting for...
Yeah, if you are... But we do have some wonderful organizations in the Lower Mainland that do, kind of away from home for the day, we're going to take you out, we're going to do, So it's a very, very complicated problem, and it's economic, it's political, it's psychological, and I think governments are really trying to get a hand. So just take our city government, Vancouver city government, where there has been a huge amount of work done on the future of the elder population in Vancouver. A very good report, was it 2 years ago or 3 years ago, which dealt with the issue. And so it depends on, as I say, if you're a high-income, developed country, the issues are quite different than if you're in a middle-income or low-income, not developed country. So I had an appointment in Malaysia. It's not the same in Malaysia. I have an appointment in India. It's not the same. I have an appointment in Australia where it is the same. They have the same aging issues. So I in answer to your question, it's complicated. A lot of thought is being given to it. We don't have all the answers.
Is there a lot of thought being given to it?
Oh, yeah. There's
a lot of thought, and then because it is so complicated, it's hard to implement any.
And then they just look at the dollars and think this is so expensive. Right?
Well, I don't think it's quite as brutal as that. I do think that there is good thought being given to if you have a minimal number of dollars, what can you do best with those dollars in order to manage this problem?
Because we're always hearing that we're going to have this big drain on this system that is going to be uber expensive as the boomer generation gets into their 80s and their 90s.
Well, the generation is quite different from my parents' generation, and maybe even from me. Well, no, because I'm an exemplar out on the right side of right field. And that is that there is a much greater emphasis in this generation, this boomer generation, on good nutrition, on exercise, on mental health, So
we're much more aware of all these things.
We're much more aware. And there's a lot of mythology about, elder people costing the healthcare system a ton of money. It's just not true. It's what we call a zombie exercise.
It's such a sad idea, too. It makes all the elders feel like they're burdening society.
Yes, and in fact, it's not true.
Yeah, actually, but then, talking about the expensive part, there are a lot of elders who end up in hospital when they don't actually need hospital. They don't need a bed in hospital. That's not the kind of care they need. But there is no other, not enough of what we do that is the nursing type of care for elderly challenges, not medical challenges.
That's Candy Ho, Director, Vice President, Marketing and Corporate Relations at Element Lifestyle, and Dr. John Gilbert is our guest. And you've referenced it several times through the show. You refer to people who are older as elders. So talk a little bit about that, just mind shift a little bit from being called seniors to elders.
Well, I am, words mean a lot, right? The kind of word you use to describe somebody, something. And let me give you a very interesting notion that I don't know if you know the Brits very well.
I do.
Their view about aging. But the Brits think about people as old when they're about 56. Ours is, we don't think about that. So you read novels and they're already talking about people being elderly, etc. And the notion of senior is one that I don't think rings true with respect to the total piece that people of my age and older provide for society. Senior has kind of one notion associated with it. Elder has a much broader psychological, biological, whatever.
Part of the native sort of culture too, right?
Yes, right. And it's a much broader notion of this person who is still, a functioning member of society, providing something from experience, from all those years of doing whatever. That is not just being a senior, which says, well, you're over the hump and that's it, now you're gone. So I like the term elder because I think it recognizes that the fullness of what it is that we do. I mean, at my age and older than me. And I think that's an important piece. The words are always important because they create the psychological space in the next generation coming up about where they're going to go. And that's who we're aiming at. Opal is saying, and Candace has given some really good examples. They're saying, I want to be part of this continuum of care. I want to be here from the beginning, as it were, when I'm kind of 55 or even some of the grandchildren. Yeah. And they're saying, I want to be in that continuum of care. So I think elder is a much more embracing notion.
Positive. And
yes,
it has it implies to me wisdom and respect. Yeah.
Now tell us quickly about some of your clients that have come in. You've had some multi-generation families come in and choose to live at Opal by Element. So what's the latest story? You had a big group come in?
A big difference in a lot of the other retirement residences. The average age is 87, and ours right now, we probably about maybe about 70, but the difference is that we are really accommodating younger generations to either stay as guests or visit or actually stay long term, because the rule from government's perspective is that it just needs to be one occupant that is 55 plus.
And 55 isn't that old.
55 is probably half the population. I actually haven't looked at the real statistics or demographics there, but 55 plus is lots of people. But so I have a couple that bought a unit that is big enough to accommodate the grandchildren to stay and the siblings from out of town to stay. And then I also have a lady who was widowed last year. She's 60. She bought a unit for herself that is 2-bedroom that will let her visiting children who live in Ottawa Ottawa and New York to visit with her. She bought a unit for her mom, who's 86 and still very independent. She also reserved a care unit for her father, specifically chose one, even though we're 2 years out, who's 92 and has had type 1 diabetes for many years and has managed on his own, but she's noticing that he's having moments when he doesn't look totally there. So she's really thinking ahead. And when she purchased a unit for herself, and her visiting daughter from Ottawa came and said, "Mom, are you going to get older earlier than you should? I can't see it. I can't see you moving in." And she's like, "Yeah, Ming, don't worry about it. This is not a rational, spur of the moment decision. I'm thinking long term. I want to be close to your mom. I want to be close to your dad. And, I want to support them and care
And
for
I want
them,
to stay
but
in one place,
not
right?
as a nurse that I am not.
Yes.
You know?
Because that is a big burden on the children.
Yeah. I'm going to be there visiting and spending good time with them every day. We don't necessarily have to be living in the same unit. We can still have our personal space, but I'm there enjoying all the activities and amenities every day, surrounded by like-minded people."
All right, we want to get in a little bit of the amenities, because it's quite remarkable what you have planned at Opal by Element. And we'll talk about that next on CISL 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CISL 650. We're back. This is Boomer Life on CISL 650.
And here is the best part. You have a head start if you are among the very young at heart.
And welcome back to the show on CISL 650. Today
No,
we're...
let's keep that song going.
You like that song? Okay, we'll have that the next time you're on. Make a note. Andy likes that one. Vice President of Marketing and Corporate Relations at Element Lifestyle Retirement, and our special guest today is Dr. John Gilbert, Independent Director at Element Lifestyle, and we hope to have you back. So it'd be great to have you. Candy's of course going to be back. Now we want to talk a little bit about Opal by Element. Now I referenced it a little while ago that it's in my neighborhood, King Edward and Cambie, and there's the Canada line there. If people want to jump, if they're still able to use transit, or you can have somebody in the facility take you somewhere, and it's a wonderful location. So kind of paint us a picture of what this is going to look like. It's pretty much a city block that you've got there, and you're going to have, as you mentioned earlier, some rental units, units for sale. You're going to have care provided at different levels depending on what you need. But there's a lot of other stuff that's there, and people get excited when they hear about maybe the facility for the grandkids to come over. So you have a sort of a noisy room, right?
Yep.
Explain how that works.
So everything that we do is about choice and flexibility, honoring everybody's unique personalities, and also about building memories and having dynamic experiences and explorations. So every aspect of programming has that in mind. So we have some that are for passive and introvert types, a very zen type of wellness spa space that you do more restorative and passive types of holistic complementary type wellness, so yoga and tai chi and qigong. But then even yoga can be intergenerational. We'll have family yoga, and we have already found an instructor who's specially certified for geriatric and family children's yoga. And that same person with her child educating certification would be able to run our intergenerational program that brings together elders and their grandkids, or if they do not have grandkids but love the energy and purity of children, they can, in a structured and facilitated kind of program, be able to tell their life stories and what they have learned through life experience, not so much maybe what they did for work or career, but character growth.
What they learned, yeah. Now, you also have like a place where families can eat together.
Yeah,
right?
So we have a main dining room that has tables that can be put together or taken apart. We have a communal table for the ones that are very culinary inclined and like to watch the action and feel the energy of a vibrant kitchen. We also have a private function room that is not just a dining room. It's also a living room setup that supplies board games, so that when children come, they do not feel like they're coming just to be a good kid. And
sit there and you know what they do? They sit there and look at their phone.
Yeah, and these are spaced out in the digital thing, right?
Yeah.
But elders don't want to feel like they are burdening or obligating the next generations. They want to come and they can feel whether that child is coming because they truly want to, or just must. So when they come there, then the adults, if they're having that amazing conversation that we hope they will have for 3 or 4 hours, the kids can still be in that space and playing with each other, and they don't have to sit still. They don't have to be quiet. So it's an enclosed and sound insulated room. But there's also, we have a portable barbecue. You can take that up onto our rooftop that has stunning views of the mountains and downtown. And on the south side of that rooftop, we have the entire building is planters supplying our farm-to-table culinary concept, but also another opportunity for bonding and contributing to the community. The residents can plant and harvest their own vegetables and herbs, and they can do that with younger generations. And our recreation coordinators can create opportunities for them to take it out to farmers markets to sell together. And then in the chef's table or open display kitchen, they can invite friends or invite family and kids included to make ice cream and pasta and pizza together, things that they cannot do even in the comfort of home because they may not have the equipment, they might not have access to certain special ingredients, they just may not have the skills. But there's a lot of elderly women, especially the nurturing women, but a lot of men too, who love to cook and then share recipes with each other and teach the next generation. So all those sorts of experiences are meant to bring people together in a more meaningful way, as opposed to sit there and then everybody's on their phone or iPad, the younger people.
I walk by this location every day with my dog on the way up to Queen Elizabeth Park. And when I get to the top of Queen Elizabeth Park, it's a pretty good hike up the top of that hill. It's called Little Mountain for a reason. I see all of the elders doing their Tai Chi up there every morning.
Yes.
And they have actually renovated, it's probably been in the last 10 years, but they've renovated the whole top of Little Mountain to have all of these covered areas. And you see all the groups every day, and I walk by with my wife, and the people say hello, and I can see that's a strong community, right?
Yeah.
And somebody living down the hill could still go and do that.
Yes, or they could do it on our rooftop. That's how I actually designed it. That exactly what I had in mind, that you can go up for fresh air and this stunning view and then do your yoga or Tai Chi or Qigong up there.
So is it Tai Chi they're doing up at top of Queen Elizabeth Park? Is that pretty much?
Yes, it is. Yeah, it is Tai Chi.
All right. All right. So that's, I can see that community just moving down the hill a little bit.
We will have community being welcomed. So a lot of it will be residents. So, but sometimes we will invite community organizations to come in because we don't want them to just be in this little space and have no connection to anybody else.
Dr. Gilbert, do you have any information you can provide around as people get older, the connection they need to have with younger people? Does it help with their cognitive ability? Do you know anything about that, or do you have any experience firsthand? I could imagine that, as you mentioned, being shuttered away on your own, you don't have the same experiences that if you were around younger people.
Well, there's certainly a lot of data that says to be around younger people is certainly good for your mental health. That's for sure. But I think that that's not the issue for growing old. I think what Opal's trying to do is to say this is not about getting unhealthy as you get older. It's about keeping everything healthy.
Right.
Which means that even if you don't have an extended family, you're mentally there, you're physically there because of the activities which are provided by this particular facility. And that's really, really important. I know I go to Little Mountain, I go to Hillcrest to indoor lawn bowl.
Oh, yeah.
Let me tell you.
Indoor, I didn't know they had it there.
It's amazing.
I know they have the curling there, but there's indoor lawn bowling. I got to go check that out. Okay.
And it's the only one in Canada.
Okay.
And
really?
It's a really, really amazing facility. And I know that the people that come they're all very mentally agile because they bowl every day, literally. I don't. But so I think that the notion of having an extended family is good if you do have an extended family in terms of mental health. But the notion that's inherent in Opal is even if you don't, we're going to give you those things which we know from evidence says keeps your brain active, keeps you active, and keeps you healthy as long as we can keep you healthy.
I have a funny story. My neighbor lived a block away. She sold her house, I guess 2 years ago. There's a new home there. It was a little old bungalow, and her name is B. And when she left, she was 97 years old. And B used to walk by every single day with her red coat on. Sweetest lady. I've lived in my neighborhood for 18 years, so I've known her for many years. Hi, B. How are you? Oh, I'm great. Are you going bowling? Yes, I'm going bowling. And do you know what her line was? Because she would go down to Grandview lanes, right? She says, I'm going bowling, but not lawn bowling, because that's for old people. At 97. Right?
That's a mistake, because the average age of the bowlers in British Columbia is 55.
Oh, I just think it's a funny story because her perception was, but she had that community. Every single day she went on transit and went over to Commercial Drive to go bowling with her peeps and hang out every day, and then she came back, and that was her group. So I can totally see what you mean. You're trying to build it all in one place.
And I don't want them to feel old. Why is there a shame about being old anyway?
That's her society.
Look at the Queen.
Pardon me? The Queen. Yes.
You should be proud of being old, because that means you've got life experience and wisdom. Like, what's wrong with being, that's for old people. That's great.
I thought it was great coming from her.
And then to me, old is like 152 these days. So
I always like watching the shows where they do the birthdays and people are 100 plus. I think it's great. Well, it's been a wonderful conversation. Our thanks to Dr. John Gilbert, our very first Order of Canada guest we've had on the show. It's been great that you've been here.
Oh, my honor.
And Candy Ho, of course, from Opal by Element. And where's your display center? It's at
City Square.
City Square, near the Kieran restaurant there,
yes,
right?
Exactly. So 12th and Cambie, and there's parking underneath, and then the focus groups there will allow community to envision retirement differently. And
well, we're going to have you back soon to talk more about it. That's all the time we have for this week's show. I'm Zach Spencer. You're listening to Boomer Life on CISL 650.